robotics, artificial intelligence, cloud computing, Internet of Things. You've possibly heard all of these new age technology terms. From cities and businesses to finance and education, smart technology solutions are transforming every sector today, and healthcare is no exception. Hello and welcome to Apollo Hospitals presents Healers of India, a unique series that is starting conversations with stakeholders around building the rural healthcare ecosystem in India. On the show today, we are talking about the role of technology in rural healthcare, and to tell us more, we are joined by Siddharth Bhattacharya, Country Director, India, Access Health, Lakshmi Narayan Rao, or Lux Rao as he's popularly known, Director and Leader, Digital Transformation Office, Cisco India and SAARC, and Nishant Pandey, Country Director, American India Foundation in our Noida studios. We're also joined by Upasana Kamineni, MD of Apollo Life and Vice Chairperson of CSR at Apollo Hospitals from Hyderabad. Welcome on board, gentlemen. Welcome, Upasana. It's a pleasure to have you all with us today in the studio. Lux, perhaps I'd like to open with you. Cisco is doing a lot in terms of telemedicine. So for our lay viewers, please explain what telemedicine can really achieve in a rural situation and what's the kind of impact that it is already creating in deep rural pockets in India.
We live in exciting times now, and never before in the history of time or mankind has technology played a role where it can alleviate the problems that actually our country faces. So when you look at telemedicine, one of the things that it addresses is the fact that, we've got a very abysmal doctor-to-patient ratio, right, and we can't have doctors available in all of the rural areas and so on. So telemedicine actually plays the role of a medium to have doctors sitting in wherever they are located and talking to patients in rural areas, thereby actually, bridging the distances through the medium of technology. Cisco is well positioned to actually address this emerging need in addressing rural healthcare problems in the country.
Okay, Upasana, give us a sense of the kind of initiatives you're taking at Apollo to improve rural healthcare infrastructure, and how are you leveraging technology?
Okay, so what we use with technology, the first thing is to understand the problems that are in the certain areas. Based on that, we run camps for them. Another thing is telemedicine. That's really, really big for Apollo, because we feel that, the rural people in the rural areas also need to have access to our top doctors in the urban cities. So with telemedicine, we are able to actually take care of a lot of problems in the rural areas and have these people have access to our urban doctors.
Siddharth, tell us a little bit about how the mobile phone can really play a role in transforming healthcare in rural India, and what's the sort of impact that it has the potential to create?
Over the last decade, the role of mobile phone has slowly transforming from the mobile device being used as a tool for voice communication to something that really transforms digital facilities. So where we are in a low resource setting in the rural populations, they can access higher skilled physicians, technicians, sitting from home or from the communities directly. The other area of transformation that is happening is in the area of better quality. Right. And the third area, of course, is in facilitating financial transactions.
Upasana, what are some of the emerging technologies that Apollo Group is currently working on, and what's the sort of impact that you're expecting to create with them?
So right now we are concentrating on a platform called Jayo, which we've just launched with Deepak Chopra, which is a wellness and awareness platform, because I think wellness and awareness is so important, because prevention is better than cure, and we totally believe in that. So by teaching people how to do yoga every morning, the perfect stretches, people have lost track of how much water they are drinking. So that's really important. Just letting people know the basics once again, teaching them how to grow kitchen gardens is, will make a huge impact to rural India and urban India.
Right. So while we are talking a lot about impact, really, Nishant, at the grassroots level, skills training and digital literacy are real challenges. So what's the kind of public-private partnership, or what sort of models can be explored in order to address these challenges?
At American India Foundation, we work with state governments and private sector players and public health organizations to design and run programs to reduce maternal and infant mortality. We absolutely believe that technology has a great potential. I think if we were to make a serious dent to the rural health challenge that we have in this country, technology has to play a much larger role than it has been playing over the last decades or so. Because we work in really remote, rural, mostly tribal areas in Jharkhand, in Odisha, in North Andhra Pradesh, and in hilltop communities in Uttarakhand, we are also very seriously aware of the connectivity challenges.
Yeah.
You know, we know that a lot of work is happening in terms of using mobile technology, and there is an assumption that a lot of people have smartphones. The reality on the ground when you talk about these areas is that connectivity is not there. In terms of digitizing a lot of documentation that happens on the grassroots level, a lot of identification, early identification of illness.
Right.
At the same time, we also think that what is going to make a greater impact is innovations in medical technology. So low cost, mobile, not mobile in the sense of phones, but something which can be carried to a village which is 3.5 hours from the nearest hospital. So those are the areas where I think a lot of innovation is needed.
Okay.
Mobile, of course, is important. In fact, we are currently working with a company to develop a tool which is mobile based on feature phones, for keeping record of the immunization calendar, for example.
Right.
So those kind of things will go a long way in improving the efficiency of ASHAs.
Upasana, affordability is a key challenge for the rural poor. So at Apollo, what are the sort of financing models that you're really working on at the grassroots level? And do you believe that corporate India ought to collaborate much better when it comes to providing healthcare to rural India?
See, corporate India and the government have to work together to create a model that can help the healthcare of the country. And the government can't do this alone and private players can't do this alone. We have to work together with each other. So there are various programs, and the CSR of Apollo is working with a lot of these programs to actually build the correct model to go out and implement. So the first thing that we are doing right now is actually analyzing the people in that certain area, so that we have relevant data to run the programs.
Lux, at a time when we are talking of Internet of Things and how it can really transform healthcare and every other sector, what do we do with pockets where there is simply no connectivity?
Internet is actually the lifeline of all of these technologies, and I think it's important for all of these places to be connected in the first place. But this is a transient problem. If anything, it'll actually only get better from here. Having said that, one also needs to be cognizant of the fact, what all could you actually do with connectivity? Think about it this way. I talked about the role of technology. I'd like to actually illustrate something that really happens on the ground. Sure. You think of someone in rural India, a poor villager who actually has no access to healthcare hitherto. There's a question of affordability as well. And some of the technology aspects that have come in now can make it possible for this poor gentleman who walks into a medical center, a mobile center, which actually Nishant was talking about. He or she could actually come into this place, and then they would, be connected to devices that can talk directly to the internet and update electronic health record. The telemedicine doctor who's sitting actually, hundreds of kilometers away is actually looking at this patient. They are able to, relate to what is the situation right now and correspond it with whatever is the case record. There's a confluence of technologies now that makes it possible for getting fantastic quality healthcare at affordable rates from a whole host of providers, healthcare providers.
Siddharth, finance is of course crucial in adopting any kind of technology and really making it scalable. In a growing country like India, what are some of the best practices that we can learn from, from other nations? Access Health has really worked in Sweden, in Philippines. What are some of the most successful models of financing there that perhaps could be emulated here in India?
We're increasingly seeing a trend that many of the new startups are getting built on the concept of making finance easily accessible and usable by the rural masses and across the general population. But if you look around the world, one of the fundamental concepts of financing for health is the concept of universal health coverage. It's about the vision that every person, no matter who, no matter where, and no matter what their age, has the right to a high quality, affordable health care. Especially in the rural parts of India, in the poorest and the economically marginal segments of the population, healthcare could create a catastrophic burden. Right. And this could drive people into poverty. And there is a need for an overall design for a comprehensive universal health insurance that covers the entire population and creates a safety net for those who are incurring large medical expenditure. If the demand for healthcare is created in the rural India, yes, technology can play a role in driving efficiency, better quality, better access, and it drives down the cost of the customer acquisition, the cost of the innovation, and helps it drive scale and impact in a much larger level and drives the health outcome and the indicators.
All right, that's well put. At this point, we're going to head into a short break. When we come back, we'll talk about healthcare startups and the huge investment opportunities Indian healthcare offers. Keep watching. Apollo Hospitals presents Healers of India. Welcome back to Apollo Hospitals presents Healers of India. On the show today, we are talking about the role of technology in transforming rural healthcare. Siddharth, India has a vibrant startup culture, and today a lot of startups are focusing on healthcare and particularly on rural healthcare. So how do you see this whole ecosystem evolving, and what are the areas that startups really need to focus on?
From our research of nearly about 300 health innovations that we have tracked across in India, we find that over the last 5 years, many of the startups are really creating technology as the backbone of their core service. Right. The success is going to be dependent upon these startups creating products that can bridge, that can create trust in the mind of both the payers and the providers in rural India. It's very important that someone who is in rural India trusts a doctor who is not located within the physical surrounding of the village. Once you have built the trust, technology has to blend into the existing ecosystem of healthcare delivery. It cannot create, it has to supplement and support the ecosystem. Right. I think the third aspect is for an entrepreneur to be successful. The real investment opportunities would come as their cost of acquisition and retaining the new customers in a very fragmented setup comes down, and the investment scale.
Lux, there are all kinds of startups today dealing with the healthcare problems and trying to find solutions to them. If someone is interested in making an investment and trying to solve a pain point of rural healthcare, what are the critical areas that one should be focusing on? What are the big investment opportunities?
Today's startups actually have to look at really what are the pain points in rural India. One of the first line of opportunity that is there is actually addressing the primary healthcare needs, and also actually the needs of people who can't really make the journey to a hospital and things like that. Yes. I would say that Internet of Things is actually a very, very welcome solution for these things. I think there should be a lot of work that's going in the area of making affordable devices that can actually be strapped on for people for post-operative care, for instance. There are actually some areas that, such as these, that are of immense opportunity. And I think, these can, at scale, these things will become, dramatically affordable. And I'm very, very happy about the vibrant startup, culture that is actually there in our country, which is also looking at these problems, Yes. It's mutually rewarding.
All right. So that's the startup angle. But coming to the ASHA workers that we were talking about earlier, there are lakhs of ASHA workers present in India today, and they are really the first point of contact for most rural Indians. So Nishant, how can technology in the hands of an ASHA worker really impact the normal rural Indian, and what are the sort of success stories that you've seen at AIF?
Almost a quarter of child mortality globally exists in India. One of the common causes of child death in India is actually diseases like sepsis and pneumonia. And one of the reasons why these diseases become so fatal is because of delayed identification. So a telemedicine will work, for example, based on my limited understanding, right, if the parents are able to even identify that there is a problem and then be able to afford telemedicine, right? And therefore, I think medical devices which are available locally at a village level in the hands of ASHAs, and ASHAs being able to use them, I think that's going to make a huge difference, at least in terms of infant mortality, as far as infant mortality is concerned. Right. So, one of the key data points that an ASHA worker has to collect at the time of childbirth is the weight of the baby.
Right.
And a lot of ASHA workers in India, and I mean a lot, are actually illiterate. Right. If you don't record the weight, then you can't refer that case to secondary or tertiary health care, and therefore digitization is something which is going to make a huge difference.
All right. Okay.
We need to empower ASHA workers with technology. That's what I'm trying to say.
All right. Okay. And Lux, one of the game-changing technologies of our times has been the cloud. Yeah. And in rural India, what's the impact that cloud is creating? What are the various areas where it can be utilized and leveraged better?
Yeah. Cloud makes it possible for us to, see what is the record of a patient actually sitting anywhere. It is ubiquitous access. To put it across in simple terms, you have a stethoscope that actually can take the data and directly, publish it into the cloud, which is seen by a doctor sitting hundreds of kilometers away. Then you have cloud, where the data gets hosted. The data is actually, resident on a cloud, and it is accessed by multiple people. Anyone who wants to see the data just has to log into that instance and is able to actually see what's happening. Then you have the telemedicine itself, which is the whole experience. Yes. You are now actually using channels, which is telemedicine solutions, to make the doctor and the patient interaction as close to real as possible. And on top of all of these things is this analytics piece that comes in. Now, the analytics piece is essentially about, getting real-time insights. Now you're able to actually catch and spot trends earlier on. Supposing there is an outbreak of an epidemic, analytics engines are actually at work constantly. That tells you that something is amiss, and then you can get corrective action kicked into place in the matter of hours and not actually days. You can actually contain the problem, very, very effectively. Analytics will also help, running these entire setups very, very effectively. It means it actually builds in accountability, because, people are now actually, the data is being seen everywhere. So hypothetically, you could actually have someone sitting here in Delhi looking at actually all of these health centers and how they're functioning on a dashboard, and then, immediately spot trends that are actually, not normal. So there are multiple benefits of actually technology in healthcare.
Upasana, you personally look into CSR at the Apollo Group. So please tell us, what are the sort of trends that you see emerging in the CSR space as far as spending on healthcare is concerned? Is it enough, or is there a lot more room for improvement?
See, there's a lot of money for CSR, but what people need to do is to be compassionate and give time. Because that's more important. And our doctors have been so nice, our nurses, some of our students also have been so nice that they actually go out and volunteer time to rural India and people in need. So I think that's what's beautiful about our organization, and I feel that needs to grow much more.
All right. So we're running out of time. So before we close, I'm going to ask each one of you one simple question. If you were to use technology for improving rural healthcare, where would you really begin?
The solutions that we develop for India has to come first, and it has to connect rural India with the rest of India. Technology would be most effective if it could coordinate seamlessly a set of services that mirrors the need of a patient. And technology can play a role in monitoring and delivering the services at every point in that ecosystem.
All right.
Yeah.
Lux?
Primary healthcare, and even more modular than what it is today, not really the primary healthcare center that we have existing. By the way, all of the things that I actually talked about can complement an existing network. We are not really talking about disrupting anything that's already happening. Right. We are only talking about actually beefing up the existing network.
If you were to use technology in rural India for healthcare purposes, where would the journey begin?
The solutions have to be based on the real needs of people. So technology and solution for whom, I think is the question to be asked. Right. There are a lot of nuances around language, around cultures. I mean, we know how diverse a country we are. Yes. We have seen that something which is developed for Maharashtra cannot be applied in Odisha, for example, right, for various reasons. So I think customized technological solution is what I'm talking about. Right.
All right. Upasana, final word from you on using technology for rural healthcare. Where would you begin the journey?
So if we actually have digital technology for healthcare that's available on your phone, and teach people how to use it, we can actually solve a lot of problems for rural India as well as urban India.
Okay, thank you very much for joining us today. Thank you, gentlemen. It's been a pleasure to have you here with us. The total industry size of the healthcare sector is expected to touch $280 billion by 2020. The most critical factor that will drive investments is technology, and the most critical factor that will radically transform patient care is also technology. With that, it's a wrap on this episode of Apollo Hospitals Presents Healers of India. Hope you enjoyed the insights. Until next time, it's goodbye.